What's up, my Adhesion Release Methods specialist friends? What you're about to see is 85 minutes of footage or so from our most recent upper body accelerator. I asked our video guy, Greg, to come in and film a bunch of it because I wanted to show you behind the scenes looks, what we're actually doing when we're doing training. I have spent hundreds of thousands of dollars, probably double my chiropractic education, over 300,000 on hands-on training myself in order to get to the skill set that I'm at. And I really want to express the importance and value of getting that type of hands-on training and how it's going to make you a better provider and accelerate your learning and skill set to where you want to be. And that's why we call it an accelerator. So I hope you enjoy and get value from the next 85 minutes, whether you ever come to a hands-on training or not. And I hope that it makes you a better provider and it helps you reach your practice goals. If you have these phrases or these words that are inspire you or align you to where you want to go, then you're going to just embody them. And it's really helpful for us to read that thing because it helps us embody who we say we are. And I've learned over the last 15, 16 years that there are certain values that allow people, providers, doctors, or therapists to do well with this system or the old system integrative diagnosis, or not do well and drop out. To start the workshop, I was just talking about why we read our vision, mission, values statement and why it's important to find words and language for not only yourself, but your team. So it's not just you carrying the load of your practice, but your whole team's carrying the load of your practice, and they really believe what you do. So we're actually filming our morning huddle in the next day or two, and we're going to post it right here for you so you can see it.
Barefoot Rehab was founded in 2010 because we saw the need to deliver chronic pain relief to the 50 million people suffering in the United States that was compassionate, honest, and lasted more than 48 hours. To place the focus on the human sitting in front of us as if everyone was our sister or brother, and to do what's necessary to get results. We envisioned a home away from home where people could walk in and feel their shoulders drop and their body exhale. A space to hold suffering so we could stand for healing in all of our relations, for the individual, family, community, and earth. Our mission is to leave people better than when we found them, become the preeminent authority on adhesion release and chronic pain relief non-surgically, offer an unconventional, holistic space to help people heal from suffering. At Barefoot Rehab, we live by these non-negotiable values: Heal Team 6, loving service, Mother Nature, impeccable character, competitive greatness. Because we are alive and continue to wake up above ground, 100,000 people can say that we've done something to lighten their load on their life path. 50 million people can say that Barefoot Rehab and the top 1% of pain doctors and therapists who are adhesion release method providers gave them permanent pain relief. Someone out there is suffering. Please consider helping us on our mission. Much love and gratitude. I am resonating today with Mother Nature. Definitely those last 3 days, I've been taking the mindful time to go outside and sit in the sun and go on the grass, sit on the floor in the grass and just enjoy just that moment with the sun. And I've just been feeling a lot of peace and grounded, having those moments. I don't feel sad, I don't feel happy. I'm happy, like I'm content. I'm not like, I guess, as fired up, but I'm still happy and grateful, and this is like a very calm energy that I've been having, and I like it, and it's new to me, and I know it's probably new to everyone else because they're not used to that, but I enjoy it.
I'm also really resonating with Mother Nature. The animals have just been coming forward to me lately, and I'm really feeling like Mother Nature is communicating strong messages of animal medicine. Yesterday I was outside giving Aspen a bath, and a black bear walked through our backyard, and I just helped me reconnect with Barefoot and recognizing, I can be as strong as the bear and trusting that, and it was a beautiful sign and a beautiful message.
I'm really resonating with Heal Team 6. I was really excited to get that message from Steve yesterday of him playing the guitar. I'm really grateful that we have patients that become family, and that I can hold space for some of our patients as a friend and not just this place that he goes to or they go to feel a little better. And just seeing him say Heal Team 6, baby, like it just goes to show that so much more beyond us working here. Like everybody else outside of this sees it too, and I'm just grateful to be a part of this team.
Oh.
I'm closer to Mother Nature as well. I had a great cranial session the other day, and the teacher suggested to be in neutral, and which I never do. So, but I went to the Mills Reservation in Montclair and just spent about 2 hours just stopping and listening to birds and watching chipmunks and squirrels, and it was fabulous. So, yeah.
Ed Hemberger is an amazing rolfer in Montclair, New Jersey. That's Ed Hemberger in Montclair, New Jersey. Would you like to say anything? Break the fourth wall.
Sure. I've been resonating a lot with Mother Nature. The animals by my house, just last week I was sitting outside, and I'm not even kidding, I had like 7 chipmunks and like 5 squirrels and a bunch of birds all within a foot of me, a mother and her baby deer. And this young yearling buck that kind of hangs with them. These things just like walk up to me, and I think they sense that like there's nothing to fear, and that's a nice feeling. And then on top of that, just impeccable character and competitive greatness, I think, are like, when I think of Barefoot, they're like the 2 things that really stick out in my head. It's like people who want to help, and they genuinely want to help, and it's, yes, there's an energy exchange of money, but there's an altruism to it too. Like, nobody needs to be here. Everybody wants to be here, and that's a big thing for me. And the competitive greatness end of it is just, we are the best in New Jersey at what we do. There's no one who can do what we do the way that we do it. And I think there needs to be more of an availability of what we do, but I don't think anyone will be as good as we will be.
Speaking of availability, I was reflecting over the past few days some of the text messages and DMs I get from, I really like when patients come in, they say, I'm so much better, thank you. I really enjoy that. But I think what I enjoy more is when our Adhesion Release Methods providers text me or DM me their successes with a certain patient who had this type of emotional response and was so grateful that they were able to diagnose and treat their adhesions. It just allows me to see that I want the work to grow exponentially, just like you just said, and because doctors and therapists are motivated enough to take on chronic pain, it allows us to help more people who are suffering and struggling. Yeah, do it.
Can you?
You ready, Ned?
I'm ready.
Okay.
Heel team 6 on 3! 1, 2, 3! Heel team 6!
Love it.
Here I'm talking about the core values, what I've seen from the providers who have spent time, energy, and money on investing on their adhesion, palpation, diagnosis, treatment skill set, what allows them to stick with this and last a long run so that they produce the skill set and the results that they want versus people who fail out. And for those of you who have businesses or have studied entrepreneurship at all, having core values is really important so that you can ask yourself, am I embodying these things? So I talk about humble pie, champions doing the fundamentals, trusting in hard work, how we focus, and Heal Team 6, how we support each other. So I just go over that in the accelerator just to make sure that people are getting their ego out of the way, they're present and focus in the room when they're studying and training, and how they're going to take that with them during the weekend training and then back into their practices when they go back on Monday. First one of them, humble pie. Be open to eating your humble pie. Be open to all feedback. The alternative is if people are not open to feedback, they're not getting as much value from this. They're not moving and progressing as much as they could otherwise. So even myself, I want the feedback. I want to know what I can be doing better. I want to know how I can improve things. So we all need to be eating our humble pie. For those of you who have been on sports teams, champions do the fundamentals. They get their reps in. My senior year in high school, we won the state championship. We lost one football game. We always focus on the fundamentals, but especially after you lose a game, coach says, guess what we're doing this week? We're tackling, we're blocking, we're catching the ball, we're doing the basics. We're not doing anything sexy or exotic, we're just focusing on getting our reps in. We just need to focus on getting our reps in today, and then tomorrow, and then Monday, every single day, and getting those reps in is how we develop our skill set. We need to trust that our hard work is good enough. A lot of times, I know at least for me, I'll speak for myself, I'm practicing, I'm getting reps in, and I'm just shitting on myself. It's not good enough. But that is not a true belief, because I'm actually very proud of where I am and where the practice is today. The hard work that I put in was good enough. So we just have to trust that you doing your reps is good enough, and that any of the mental chatter that's trying to tear you down, that needs to go in a box somewhere. And you go in the closet, and we just keep focusing on what we're doing. And that means that we need to focus on being present as possible with what we're doing, where we're doing, and not letting ourselves be distracted by other things. So we need to be fully here now, and then that will be leverage that we take going forward this week. And then we use this term, Casey always does this huddle, and she breaks us in the morning, heal team 6. So the gravity is, this is serious. These people have been to so many other doctors and therapists, and they've spent so much money, and they're suffering, and their partners are suffering, they're struggling. And Heal Team 6 means to me that our mission is serious. And if we're not going to take this seriously, what other doctor or therapist is going to take this seriously? And if they're not even addressing adhesion, that doctor or therapist isn't even in the ballpark of being able to help these patients. So Heal Team 6 is, we need to take this seriously, and then we as a team need to take this seriously. So now we're going to do some range of motion testing, some provocative testing. Then I'm going to feel all your tissue, see how much adhesion you have. We're going to diagnose you. I'll let you know my expectations for treatment. You talk with Kim, our patient advocate, and decide if you want to proceed with a fee per visit or a case fee, and then we'll jump into treatment. Does that sound like a plan?
Sounds good.
Cool. You're going to tell me with each of these tests what you're feeling, if you can point to it that's helpful, where it is, and then you're going to grade everything from 0 to 10 intensity. A lot of people won't want to tell you certain things if it's not pain. They'll say it's normal, or it's fine, it's good.
Stretch.
What does
Good
that
stretch.
What does that mean? Be more specific. So we just have to train them in order to feeling their body, because they're not used to somebody paying attention to detail. They think everybody is just looking for 9 out of 10 pain with any of their tests. I want to know your 2 out of 10 stretch, because that might tell me where you have some type of entrapment that will actually help you long term going forward. So all the details and the intensity matter. And the instructions are, they're standing off the wall, you're just having them look straight forward at the horizon, they're not paying attention to anything. This is their neutral. -4 degrees. -3 degrees. So that's his neutral. Casey writes that down. Feet, shoulders, head against the wall. And then you're going to take his chin, tuck it in, and hold there for me. Then I press stop. 13 degrees, 52%. What do you feel?
I feel some pain right here.
Pain?
A little bit, yep. And 4 out of 10.
Right lateral C0, C1 area, 4 out of 10 pain.
I would say a pull, not a pain.
Pull.
Pull.
Now I'm going to take his chin, and we're going to bring him down. I'm tucking in a little bit here, and I'm tipping this until it can't go anymore. Phone goes on the glasses. 64 degrees, 106%. What do you feel?
I feel a little pull in like my left scap. The 2 out of 10.
Left lower medial scapula, 2 out of 10, pulling. Same thing. Stay there, please. And then tip forward from here until his lower scapula is just about to come off the wall. I'm touching with my finger, and then I stop there. Phone on the glasses. 84 degrees, 92%. What do you feel?
That same area in the left scap, and maybe a 4 out of 10.
4 out of 10, same area. Good. Done with that. Back against the wall. The head is going to be slightly off the wall, so you don't want it resting on the wall. You're looking straight forward. Now for this, you're going to be propping. The phone is sitting. Can everyone see how the phone's sitting on my fingers? Middle fingers, thumbs. So it's 4 points. And you're putting it on the side of his head. Hit start. Slowly turn your head to the right, please. Making sure he's not laterally flexing at the end. His left scapula stays on the wall. 66 degrees, 72%. What do you feel?
Nothing. I don't feel anything.
No symptoms. Slowly turn to the left. $69 degrees, 75%. What do you feel?
A little bit of a pull right here, about 4 out of 10.
Left C5, C6 area pull. 4 out of 10. Watch me. In a moment, I'm going to have you bring your arms out to the side. You're going to come back down, and then you're going to hold your arms overhead like this.
Okay.
2 fingers, bicep above the ear to the head there on the right. 2 fingers on the left. What do you feel?
Nothing on the right side. On the left shoulder, I feel a pinch, about 3 out of 10 in the front of the shoulder.
So our lumbar ruler. So we're going to do thoracic flexion now. Chin down to a sternum, and then let this collapse straight down. Notice he's going straight down here. He's not bending forward. And then you're going to take the ruler. Anything more than 2.5 inches or more is a flat spot. That's no good. So that's 2 inches. I'm just tilting. That's all less than 2.5 inches so far. It's close, but he's still good. And then down here. So T12 down to L3. He's got a 3-inch flat spot.
I feel that pull in the left scapula.
Left medial scapula pull, 0 to 10.
4 out of 10, and then right in here, I just felt like some pressure or compression, like right in the spine.
L2, L3 midline compression, 0 to 10.
3.
3. What I'd like you to do for this, and we'll have to get you another body marker, is for the sake of practice, I don't do this so often anymore, but I find it very helpful. You find if you're doing thoracic flexion, you find the worst spot and you just write the lines down. Because when you remeasure it, it's going to be very obvious if they have more flexion and there's less flatness now. So this is just a very helpful, I don't do it all the time, but I recommend if you're starting to work thoracic flexion, to make things easier on yourself, write the distance that they're flat with a body marker, treat, and then recheck. You're better
So will
than
you
that.
run all of these tests with every cervical thoracic client? Do you pick and choose as you go?
You'll have to decide that as what you want to do. The best practice is probably to do it on every patient.
Yep.
The best practice is when we get to the principles that you learned last time, slow is smooth, smooth is fast. So we take as long as we need to take on each patient and get the details down now, because if you did that now, 1 year from now, you're probably going to be ahead of people that took you 3 years to get there because they were skipping pieces. Hands here, feet and knees together, and then he's going to rotate. Good, rotate as far as you can this way. That's staying together, stop. To the left. 54 degrees, 97%. What do you feel?
Left medial scap area, 4 out of 10 pull.
4 out of 10 pull. Left lower medial scap. So in case he said that 4 times, what I've been doing lately is I'll go get the yellow highlighter and I'll color code all of those. Because I like to, I remember having friends in college and they had all these extensive note-taking systems where they color code stuff and all these notes, and I've learned that that helps me just connect the dots and just see things. It's more obvious. If I see the yellow line with 4 tests all at the same spot, I know that I'm going to want to check that on the exam when I start palpating. Rotate as far as you can this way. 49 degrees, 88%. What do you feel?
Right under the right scap, I feel a pull, 4 out of 10.
Right T11, T12 area, 4 out of 10 pull. Can you make note that his shoulders were shrugging during UCF? When we were doing a lot of exams and I wasn't super confident in my reported findings, I would take videos of the shoulder. This is just very obvious to see, and it's a great way to do content. Pre-test, treat something, post-test. And people love, this is one of those tests that people really like seeing, so you can just take a video of it. Okay. I don't know about all of you, but if I'm going to learn something or study something, I like to shorten the curve as much as possible so that I don't have to waste my time, energy, or money in doing something. I want to learn it as fast as possible. And so I'm a big fan of meta-learning principles that allow us to get to a point quickly. You're going to start to see in the accelerator workshop, I keep looking off to the side because I'm looking at the video, the groups of 3. So the doctor, there's a patient, and there's a clinical assistant. There's enormous value in not only the doctor doing the doctor procedures, but also in being the patient and also in being the clinical assistant. Because when you're able to see from a different set of eyeballs, a different perspective, it can give you value where you're not often seeing things when you're just in the doctor's scrubs or uniform. So you're going to see this a lot during the exam procedures and also when we start doing treatments. And this is very important so that it gives us a robust perspective of what we're trying to do when we're treating somebody and getting rid of their chronic pain. Into groups of 3, doctor, patient, CA. Let's get all of the data for each person so that we can do a bunch of treatment this weekend and we can retest that stuff. And just support each other. Casey will come around too because she does this all the time. And yeah, let's do it.
So you're going to rotate all the way to your left.
The fingers go on.
The fingers are your anchors.
Yep.
This one.
71, 78%. What are you feeling there?
Same tightening on the left side this time.
Okay,
Same.
got it.
0 to 10?
1.
1. Right side. Sorry, left side. C4.
Same
C5.
spot.
Okay.
Just left side.
There.
Yeah, same spot, left side.
How do I correct the lateral flexion?
Your arms
Thank you.
Up, all the way down, up, bring them down, and then
Good.
bring them
64
up again.
degrees, 70%.
For right.
For left rotation.
Sorry.
You're
Inward
good.
ideas.
And how was percentage?
70%.
70.
What do you feel?
Pulling here all the way.
Yeah,
This
bring
whole
them down.
Pulling right side from
mastoid process to
mastoid all the way down
And then no,
to
this time you're going to do one more
Jennifer Greco, Buffalo, New York. I actually went to school with Dr. Chris. I practiced chiropractic for 13 years before starting the adhesion release. I think that people were getting some relief with the chiro, but it was kind of not as encompassing as now. So the outcomes are better with adhesion. People are getting out of pain and not just kind of having a Band-Aid to the pain, right? So we're actually having some long-term changes in the patient's health.
I'm looking above the ear, the bicep to the head, and one finger.
I was just checking to make sure.
So one finger in each side. What do you feel in there?
I feel pressure on the upper traps.
On both sides?
Yeah.
0 to 10.
2.
Pressure, both upper traps, 2 out of 10.
Oh no, I'm on T rotation. Hold on.
69 degrees?
Here.
69?
No.
How many degrees?
It was on T rotation.
Yeah, but how many degrees was it?
I don't remember. I just turned it off. Or what did you write?
69 and 124.
76%.
Okay.
No pain, no pulling.
One side, and then the other.
No pain, no pulling, nothing.
Nothing.
No feeling, no symptoms.
Although that's my dad's side.
No, just relax on
Okay.
All right.
I like to tell them, like, try to keep the best.
Should we do the shoulder before we sit down like
Yes,
that?
it's
up to you.
That's what he said.
Okay.
I'm just.
All right.
So you
What
still
I'm gonna have you do, look, watch me first.
Yeah, sometimes
What I'm gonna have you do is raise your arms up like this once, put them back down, and then raise them up one more time, and then hold them up there with your hands crossed up above.
Reset. Like this. Beep.
Do you want me to actively squeeze my legs together?
Cool.
Or just like
Keeping your feet
touch
and
it.
knees together.
What do you feel?
Okay.
Nothing?
And then rotate
No,
to
it's
the
a little,
left.
okay, it's a little tight on the shoulder.
Okay, tight where?
Here.
Delta
38.
0 to 10.
What do you feel in there?
1.
like a borderline cramping
Point.
sensation.
Here.
Or more north, maybe.
Cramping left side, T8 to T10. These are here.
Yes.
Yeah, T8, T10.
Just do the
Okay, hold the stick again.
0 out of 10.
Maybe I'll put 7.
Those are 10s.
It got, yeah, it was getting worse.
It's getting bad.
Oh,
No
no,
one's
you
on
got
that.
back there.
Sorry.
You're strong, so you
Just
go.
add to it.
Which one's worse? Okay, rotate to your right.
Is it still pulling or is it a different sensation?
44, 79%. What do you feel there?
Same kind of cramping sensation, a bit lower
That's lower line.
and more lateral. That was on the right
Lower
side,
lateral
on the right
strength.
side.
Pointing here.
So,
0 to 10.
what would you call this area here?
This is like
0 to 10.
T10,
T11 on the
Or now you
ribs.
got some stuff
Hard.
there.
11 of the ribs, and 0 to 10?
don't think about
7.
7.
Should.
Got it.
With
No.
shoulder abduction, you have to make sure that they stay in plane, that the bicep is covering the ear. If this is as far as they get being that plane, good. Because what will happen is they can't do this and then they're like, they come over this way.
Yeah.
See, the ear is not being covered by the bicep. So you have them redo it and you can stay in this coronal plane. And that's how you do this test. Thank
He
you.
was in the plane, right?
Yeah, he was. I made sure he was. So this one, you're just gonna have him tug his chin down and just slouch.
Also, it's like, oh my gosh. Apparently I'm in a lot of
You could try to relax while you
It's
do
just
it.
that,
Yeah.
it's just been.
He's gonna let you know when to do it.
Differentiate.
He's a doctor.
You should get that treated.
Been trying.
Okay, so
Maybe I
chin,
see right here.
chin down and then
You're gonna put this
curling all the way.
across your chest like this.
Right, yep.
All right, hold. And then with your knees together, we're gonna rotate this 1 second.
So every 2.5
Keep these knees together.
is
I'm gonna have you rotate
considered flat.
all the way to the left.
Do you want your phone?
Oh, jeez.
I'm just checking.
So if you see the 3-inch flat spot, it'd be like.
My patients say, you know it's the other side, right? I'm like, okay.
I know, it's the best of us.
I'm like, you flipped over.
It happens
sorry.
to the best of us.
Dr. Todd Dersham from Massachusetts. So I've been doing the adhesion stuff for probably 7 years, and really getting into the training in this past year. There was just a moment that I had this conversation with myself where I wasn't happy with the results I was getting for people. I felt like there was something more, and when I started watching Dr. Chris and some of the other practitioners getting these great results and talking about it, there was I had a moral and ethical dilemma, and I just didn't feel right having this exchange and not feel like I was making a permanent relief for someone.
So now we're gonna check your thoracic
Like you're the
flexion.
doctor.
So I'm gonna have you tuck your chin,
Albert, you mind if we use your phone?
curl down
Or-
through
yeah,
here,
thank
and then
you.
you just
This goes through.
Okay, so here, we're gonna go use it.
got some nice spinous processes up here.
You're welcome.
So
For example, neutral position.
you said 2.5 inches.
That's 2. You're
The
good.
measurement.
All right, I'm just
You have to do this top, and that gives you the range of the.
segment to segment.
Yeah, basically. And then you reset, and you can take.
Cool. So first one we're doing is UCF.
You got it?
What do you? It's starting to get a little flat there.
Yeah, sure. Okay.
So that way we're,
Yeah.
We already
Oh,
have
but
it.
then
We
So-
already
has
have
is,
those.
we just get it.
I'm just kind of looking through here, right?
okay, so then.
Once you find a spot, do what you just did though. I like what you did before. Pick up the ruler and put the 5-inch spot right there. Because if you do it the way you just did
Okay.
it gets confusing.
Just off the wall.
You doing all right? 3. You said 2.5.
That's 2.5.
-6.
That was, you said, or?
Yeah.
I thought it.
And then you're gonna send it back to the wall.
I'll have you try to lean up.
Okay. Yeah, right there. So I would mark that.
Yeah, 2.5. And you have to tell her.
I want you to just relax your head. I'm just gonna tuck your chin up there for you, all right? 4.
You all right? Or?
Yeah,
Mm-hmm.
I'm feeling stretching.
Okay.
On here.
Left suboccipital stretching, scale 0 to
We're
10.
good there.
Severity.
2.
2? 2 out of 10.
When you say the range, that'd be easier to say because that is.
That's about 2.5 there. So
Oh,
what do you want me to say?
So you said 4 degrees?
Yes.
I was gonna tell you percentage after.
You okay?
If I would have been like 10% function.
There, and then there's a spot underneath there.
Yes.
That's flat too. I'm not gonna write on her, but
This is not a good sign.
Actually, it is.
and flat through there.
Okay.
So you're flat basically from like here to here. Actually here to here. So that's really good.
Next one.
CF.
CF. So this one, we have them against the wall still.
Yeah.
So then I'll have you lean up against the wall, Albert.
And you just bring your head down. So he's gonna tuck his head.
My name is Albert, and I'm from Barcelona, Spain. I practice here in the city, in New York City. I'm a chiropractor. I'm also a personal trainer. I've been a chiropractor since 2014. I graduated in 2014. I've been doing personal training for about 3 years now. It's been a beautiful journey being able to have this technique to be able to help people that with chiropractic care they were getting better to a certain point. It's another tool that I have on my toolbox to help people.
At the same time. Albert, what do you feel here? 55 degrees, 91%.
then, but after I got down from here,
I feel pulling
I typically would have said like
here
T4,
and
T6.
here.
Bilateral medial scapula at T5, T6 area. How intense is that? 0 to 10?
3.
3 out of 10.
Okay.
Nice. Thank you.
Let's do the next one.
And then next one is upper thoracic.
Yeah, so the medial scapula is here. You'd want them to roll off the thing. Once that's coming off, all right.
Okay, there you go. Okay, I see. And then I'll measure off the glasses again.
That's right.
All right. So now I'll have you flex your neck down, look down. Great.
Don't tell them what to do. They're
No?
gonna do whatever they want.
So
You do. This is the part where you're in control. And they're just there telling you what they're feeling. You let them know, all right, I'm gonna do one more test. That's all I say. They don't know what they're getting into.
So then I'll be like, all right, I'll do one more test on you. Down.
And then just tell them to slash your shoulders and roll over.
Over.
And
Right
then
there.
boom.
You would write T4.
How are you
You
feeling?
can let go of your hand.
25-inch flat spots.
What are you feeling, Albert?
Yeah.
That's good.
Just the ulnar distribution.
Pulling, stretching,
Remember, I was
tightness.
like, oh, it's nothing.
Is it 1%? Did I do this right?
Cut it out.
I think I didn't press start like in the beginning.
Yeah, you had their neutral at 64.
Here we go. So go to 6. Put
So
6.
you start the neutral before you do the test. That's how it's easier for me. So once I do the test, I just click.
6.
Yes.
There you go.
Okay, now I go.
All right. Here you go, Albert. I'm gonna do this test and tuck your chin in, and you're gonna slash your shoulders. And then you're off. Great. What are you feeling right here, Albert?
I feel nothing here.
67%. Degrees. 73%.
No pain.
All right. No pain.
No.
All right. You can relax. That's as far as you can go, Albert.
Yep.
67 degrees. 121%. And what are you feeling?
I'm good here. No pain.
No pain.
No pulling, no tightness, no stretching.
No. Nothing.
So we're gonna tuck your chin again for me. Okay, we're gonna drop the head down. Then we're gonna come all the
Whenever you're
way
ready.
down to your shoulder. Just starting to come up a little more.
My ass for symptoms right now.
Good.
No, come back down. You're just watching the movement. Watching everything shift.
60 degrees, 66% function. Lindsay, what are you feeling on that?
Watching the scabs. How slowly you are.
Just a little tension.
Where?
Harder for him.
Probably,
Hold that.
Same spot?
yeah, just
All
about the
the
same spot.
Did it get more intense on that one than the other one?
Gotta crunch me back down. Sorry.
Oh, it's okay.
I came out of it.
Oh my gosh, crunch back down.
I'd
That's
say
fine.
one finger. One finger? Yeah,
So
one finger.
she's
A bit more on the
losing
right
the upper
side,
cervical
but
flexion.
it would be
Just be
two.
mindful.
Oh, okay.
If you want them,
Alright.
they're good. They're good.
Oh,
They
you
start
feeling
going like
Albert?
this.
Okay, so do you tuck your chin for me? Do you kind of keep tabs on that? Like how do I, oh yeah, see I like you
Just
check.
watching it.
Yeah,
That's what I just saw. Come bend down more.
I see what you're saying.
Okay.
What do you, same spot?
Yeah.
To the left?
Left to the left.
0 to 10.
And 0 to 10?
1.
Okay, 1, same spot, that T7 area, pulling.
So it'll
Good.
be a 3 out of 10.
And no
Pinching.
lost
Pinching 3 out of 10. And through
some
your shoulder.
chin
Got it.
tuck.
And then what are you feeling here, Albert? Tightness.
Okay, so we can take the glasses
Lateral
off. Right?
scapula.
Thank you.
0 to 10.
You're gonna look straight ahead for me. I'm gonna turn towards the right.
What are you missing? What are you missing?
What did I miss?
And then
The thumbs, the leg,
Her back was off the wall.
Oh.
And even as she started turning her head, her thoracic spine started going like this.
Okay.
Tingling.
On the left hand.
Oh, that's good.
One
I
holding.
probably missed. Good. Rotate.
All the way down.
I don't like that
No on soldier abduction.
because this is rolly.
Okay, help me.
On the inside.
Yeah, mostly in the inside.
Left forearm. No, do left
I mean,
forearm into the
it's
hand.
kind of weird.
Instead of pinky and ring.
But look, these 4 points are on. So thumbs, fingers. It's almost like I'm grabbing this part. So the phone can move a little bit, but it's gonna end up in the same spot as she rotates the head.
I'm getting like not as good data, which
Correct.
makes sense. Okay,
At
so
the end of the day, that's what makes it more fun because like, this is your information and it's like, oh, you get to watch
Like
how
that?
all the data points.
which ones are touching? Show
Watch
me.
how they change throughout treatment.
Shoulder
Middles.
abduction,
Oh, and
left
thumbs.
scapula.
Okay.
Or right
You could
scapula
do
is more.
the index on top, but these 4.
Okay.
Yeah, no, you're.
A little pain here.
How intense for 0 to 10?
1.
But left,
This arm, when I do bench presses or something like that for a few days, and then
the bottom of the bench.
Yeah, and when no,
Oh, when you're pushing up.
no. After working out, I feel like weird shoulder, and when I wear a backpack, that it's not heavy, but when I wear a backpack or sometimes I carry my dog, I have some pain here and really inside here, and it feels like my shoulder is weak.
It's good stuff.
Yeah,
Cool.
not
So
for me.
I know. Good stuff for us to help.
Next one we do is rotation.
Yes.
Yes. Rotation, flexion. And ready, ready.
Alright.
Delt contraction.
Alright, Alvaro, on this test, I want you to put your knees together and keep them there, alright? And
Feet
you gotta
and
hold
knees.
this up, and you gotta keep the dowel close to your shoulder.
I like that word. Magic dowel.
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 I would call that a staff or stick.
Okay.
So thoracic rotation. What do I press reset first?
So you're gonna click reset. So we are at 0, right? And this is when you start. And that's your starting range. And tell them to rotate to the left.
Alright, go ahead, rotate to the left. Keep those knees together. Great. And I just go up to this.
Yep. Make sure you're nice and steady so your numbers aren't fidgeting.
What do you feel?
Good.
67 degrees,
Just a little bit of
121%.
tension.
What are you feeling, Albert?
Axillary.
A lot of pulling.
Pulling in the left paraspinals, lower thoracic,
So
T7,
to armpit,
T7,
Higher.
And so like a little bit of
There?
deltoid.
Starting here, yeah.
okay. Let's go
you can tell us. Yeah, deltoid, and then so just right
T5 to T8, left paraspinals.
0 to 10, that pull.
That was a what?
It was a heavy one. That was a 7. Yeah.
Good.
Hiding some.
62 degrees, 112%. What are you feeling, Albert?
Same area and the other side, exactly the same area.
Exactly the same, right paraspinals, T5 to T8. What words would you use to describe it? Or same thing, right?
Yeah, same thing.
I'll have you look down first. Yep, and all the way around out your spine. Slouch over. Is that all you can do? Oh, we're forcing overpressure?
Just poke him just a little bit. See, that's all he got. That's all he got. That's all he got.
Great.
Stay here. One right here. To keep tabs on it.
So she's got a 3-inch spot from like T2 to.
And you want to know which areas are flat, and then that's will be the range. So if it's like T.
I was spending a lot of time with people. I was putting a lot of effort and energy into figuring out what was going on. And I was getting pretty good results, right? I was being a diligent practitioner, and it always felt like something was missing. Like we couldn't fully turn the corner, or I was getting lumped in with everybody else. And I felt like I was trying to go above and beyond, but not always having all the tools that I needed to get there. And so once starting this work we just noticed it was just completely different. Challenged your mindset, challenged your ability to diagnose and solve the problem. And I think that part is missing, right? If someone comes in, my back hurts, okay, we're going to treat you here. We're going to, you're testing, you're doing things, but this is like a full system. And we're really getting people better than no one else is getting better.
It was more on the left side. I would argue that you're a little higher. I'd argue that this is
More on the left side.
Yeah, more on the left side.
Like here.
Yep.
Where?
Through, right? Yeah, right there.
So
Top
2
of the
inches
left
from the
spine's
spinous, pulling from like T9 down, or does it stop?
I'd say probably just starts a little bit higher up.
Okay, so T7 to L1. 0 to 10? 1? 2?
1 to 2.
Pulling.
Yeah.
Sorry, I wasn't.
1 to 2 pulling.
I'll probably say
Great.
this then.
-3.
I've had that, okay.
Okay.
So you just make sure they're
All right, we're gonna hit the block. And take a step back, head against the wall. Butt, head, oh. Okay. And you just let me know what you feel, where you feel it, and 0 to 10. 10 being bad, pain, 0 being nothing.
What'd you feel?
Just pain, right?
Pain, pulling, stretching, anything.
Okay.
Same area, like that T8 to...
Yeah.
Okay, so T7, T8 to L1. pulling.
15 degrees, 60% function. What do you feel here?
Can I ask a question? If the other side was a 1 and you said this was slight pulling, is this side less than that side?
Yeah, this side is left.
Feel
Well, she's at 2 on the other.
Oh, she did?
yeah, like a pressure on my neck or in the front. That's about it. Just pressure myself, pushing down at it in the front. Nothing pulling in the back.
Got it.
Well, he said something really
0 to 10.
about
One.
that I've been
1 out of 10.
figuring out is like people aren't used
Right.
to that. Like,
Adhesion release is more focused on soft tissue, nerve tissue, which can be related with chiropractic. But I like the the finesse of both techniques. They have finesse, but in adhesion release method, you are able to do something that you cannot do with chiropractic, and vice versa. So I think it's complementary. They can work very well hand to hand.
I just don't know where to write it down on the.
I would put the 60 right here.
60% for the
Yep.
60%.
I didn't know that's what it was.
all of a sudden they're like,
Sorry,
no,
bud.
No problem.
Cool. Compared to what?
Awesome.
Don't have
All right,
anything.
I'm gonna bring your chin in. I'm gonna bring your head down.
1's this, 6 is B's, like...
Okay. And then
Right.
I think mine will stay on here.
Cervical flexion, 68 degrees, 113% function. What do you feel here?
I feel a pull right here.
Pull in the left
Okay, and
mm,
CF is just basically the one where you bring your chin down.
C5, C6 area.
Sorry, you're fine.
0 to 10, Casey.
Okay, and you just
One.
stand away from the
1
wall
out of
for the
10.
first test?
Off of the neutral.
All right, come back up. Chin in. Bring your head back
It doesn't
down.
work on the left side.
So
We're
basically,
gonna slowly peel your
balancing
shoulders
it
off
right
the
here,
wall.
and then I will have you.
Don't push it down.
Good, right.
Okay, so I have him.
CTF is 85 degrees, 93% function. What do you feel here?
Feel a pull right here.
Between both sides, bilateral, medial, scap, pull, 0 to 10?
2.
2 out of 10.
Now you're going to see us get into the treatment. What we typically do is I show the anatomy and what we look in the anatomy app. And then I'm going to demonstrate the protocol on an individual. And then the groups of 3 are going to rotate through on each other, on me. And then I'm also going to treat it on them so they can get what it feels like. During the accelerator weekends, on this particular weekend, we usually do around 10 protocols. So rectus capitis posterior, major, minor, nerve roots at scalene, ovator, scap, spinal, accessory nerve, neurovascular, sleeve with subscap, infraspinatus, teres minor, median nerve tract, radial nerve tract, ulnar nerve tract. Very different than active release technique that has 150 protocols. We spend a lot of time on each protocol, and we also practice palpating so that if somebody feels some type of greater occipital nerve entrapment at rectus capitis posterior major, we will pause and we'll say, okay, that's in the way. Let's actually do something about it and see if we can do something about it and treat it. Because that way, everything is very practical and the doctors and therapists can get real-time value and know what they're trying to feel from a principle perspective that makes them better going back to work on Monday. So I feel that this is very important. And so far in the past year and a half since we started Adhesion Release Methods, I've seen that our doctors and therapists have evolved relatively quickly because of this intense focus on palpation. So first you're going to see me getting into the suboccipitals, and then you're going to see a bunch of other structures too. There's capitis. There's upper trap. Take away upper trap. There's capitis right here. Take away capitis. There are suboccipitals, so they're relatively deep. Major is this one that's more upright and vertical. Minor is this one that's more horizontal in here. So this is major. What we're going to do first is we're going to practice palpating. What you're going to do is you're going to move the skull into upper cervical flexion and you're just going to feel for tension. It's still something that I'm practicing. How tight is it pulling? Can you perceive on one person versus another person that one person has more tension than another? So that's one way that you can practice palpating without doing diagnostic passes. Or we can actually do diagnostic passes. So to do this, we're going to find the C2 spinous process, which is right there. That green bone. We're going to go off at, if we're treating this major, we're going to go off at 1 or 2 o'clock of that spinous process. And we're just going to sink in deep next to it. You can just sink in as deep as you can go, or if you want to be slow and practice going into the layers of the tissue through upper trap, semispinalis capitis, then you'll get into that tissue. Then you're going to pull at a 35 to 45 degree angle out obliquely that way. So we're going to sink in, and then with this elbow out a 45 degree angle, you're going to pull out to the side with your bicep going this way. And then when you start to pass, you're going to be using your finger to pull and then gently guiding the skull into upper cervical flexion. We're going to start with major and then we'll get into minor. They're going to be in this position, the headpiece is out of the way. The back of the head is on my leg and thigh. My other hand is across his forehead here. So one way that I practice palpating, I find the EOP and the C2 spinous process. This is my area where I'm palpating. Upper trap is first, then semispinalis capitis is next. And then if I sink deeper, and I'm generally going to sink, I'm usually using this middle finger backing up index finger. I'm trying to keep my wrist isometric. My elbows hang off the side. I take depth by pushing my scapula down, and I drop my sternum. For every inch that my sternum drops, my finger should be moving up an inch. If I drop my sternum and my finger doesn't move, that means I'm bleeding force through my shoulder and my elbow. So wing bone down, so when my sternum drops, my scapula is not sliding up. My sternum drops because my elbow's going down and my finger's coming up. That's how I take depth, so my body's doing the work and I'm not doing this all day. So EOP, C2 spinous process, I'm just going midline of C1 and then going out a little bit. And now I'm tucking him into upper cervical flexion, and I'm feeling for tension underneath semispinalis capitis. You won't feel anything else pull tight. If you feel anything pull tight, you're on the suboccipital. Semispinalis capitis won't pull tight when you do this. So you want to see if you can just feel for tension with minor and then major. So that's how I'm palpating to see if there's any tension there. So we're going to do that. And then we're going to do a pass for major. So I find the C2 spinous process. I'm coming out If this is the spinous process, I want to be right here on this side. I would be on this side if I were on the left side of major. So I'm going to be right here. I'm going to sink in here, and then I'm going to take my tension set down that way in the direction of my forearm. I'm on the C2 spinous process, 12 o'clock. Now I'm at this 10, 11 o'clock of the spinous process. I'm right next to it. I pick up my finger so I'm not pulling skin from it. And now I'm going to sink in from here. Now I'm in the tissue. Tension 1 with my fingers, I'm pulling a little bit. And tension 2 is with my elbow. My lat's engaged. Now I'm continuing to pull with my elbow as I pull him into upper cervical flexion. Good. It's mostly this and a little bit of this. What you don't want to do is do this and a ton of the skull. You want this to be driving. When I said tension 1, you sink in. Then you're going to do tension 1 is just a little bit of grab on the muscle. Tension 2 is this.
The thumb is just resting, correct? Or
Just
is
resting.
there- okay.
Just resting. And you're externally sliding because the muscle's moving away from you. So there's the SP. I'm right next to it. Sinking in. Tension 1. Tension 2. With my lat, it's engaged. I'm pulling. And I'm driving. Practice palpating the suboccipital region right in here. So you're going to put your fingers right here and here, and you're going to be feeling for tension. And then we're going to do a pass on major.
Break.
And talk out the steps so that your partner can support you.
To feel
You okay?
just, I want to go layer by layer through the tissue. So I'm looking for this top of the face of the skull. Should be right around this area. I gotta go deep into.
Scapula down, dropping, getting depth, flexing to see what's pulling. Good. I'm gonna switch. Do you want to feel it too? Can we switch,
And
or you want
compare
to?
right to left and see if you can feel more tension on one side than the other.
Okay.
So that's a good way to
Same thing.
see if there's anything going on.
I feel like
And it's less of your toe coming up, and it's more of you pushing the skull.
My toe, if I'm flat, it's gonna be lower.
You might be able to prop up the stool on the heel on the stool. You might have to rotate it a little bit.
I got your head, James. Don't worry about it. So
Supporting him.
I really, this is going horizontally, so this has to be.
You need a little bit more room for your elbow to sink down.
Ah.
I think I found it. Pretty confident I found it. Because that's the only thing that's moving horizontally like that, and it's at the top of the spine, top of the neck. So.
Is that going up more or no?
No, you're bleeding a little energy out of here, out of your arm, I think.
Okay.
Maybe I can't see you, but I can feel it. So you're here, right? And you're gonna lean your chest forward and make sure that this arm's resting on your leg, so you can pick up your knee a little bit. So
That?
Yep. But you're gonna keep. So don't lose this. So you're gonna lean in, right? Bring your chest forward. Okay. Did you switch knees?
No, I kept this knee. I'm having trouble with this lever thing. So,
This takes a lot of practice.
Okay.
This has to be engaged down.
Mm-hmm.
And then when it's engaged down, then when you drop,
Right. It goes.
that's coming up like a lever.
Okay.
But if this is not engaged and you drop your sternum,
Then it just, yeah.
nothing's happening. So this has to be contracted so that
Gotcha.
this takes a lot of practice.
Okay.
You doing the other side now?
I'm just gonna go back actually to the same spot.
Okay, great. So you're a little low.
Right.
feels like it's giving more quick walking to your fingers, like behind
This
it.
side?
Yeah, like it feels thicker, essentially.
Am I too far out?
No.
So it feels like pressure going and happening on the right side.
No. Right in there.
Okay.
And just keep leaning. So don't, remember, you're not using your hands, you're using your body. So you gotta make the force go through here. Yep. Keep leaning.
Okay.
So then we go up, and then when we take attention, you pull towards, yep, first, not so, yep, and then as you lift, yep.
Moving the capitis out.
That's only for minor. Is that what you're doing?
Yeah, well, I was palpating, but I'll do a pass here for major. There's two things. One is being around other people that want this type of success for their patients. I don't think I run into any other chiropractor that truly like wants this for their patient. There's so many other things that they put ahead of the results. You know, when I get into a room with other chiros, it's not about like, oh, I got this person these awesome results. It's how many visits and I'm sick of my notes and, you know, just all these other things. But when I'm down here, we're talking about these, you know, phenomenal results that we're getting. And I think that's the reason why we all signed up. Yes, to have a great business and all that, but that's the biggest thing. The second was implementing. There are steps and you're taught to do these steps. And when you don't do those steps, you feel lost. You don't feel like this is working to the extent that it can. And the one thing that I did that made the biggest change was actually in the past month. I was feeling the same way. Even leading up to it, I was getting great results, but there was steps that I was skipping. And so what I did is I went back and I implemented a lot more of the steps, the paperwork, the pre and post test, all of those. And then being able to convey that and communicate that to patients. Within the past month, we've gone from seeing about roughly 70 people a week, and it jumped right up to 90 to 100. And that was, I know, from implementing these things because we were getting immediate referrals.
I couldn't tell if you were just feeling the tissue or you're doing a treatment pass.
Okay, which hand are you using?
This is 1 o'clock, which is my left hand. This right hand is just keeping your head 1 o'clock.
Okay. But,
Find the C2 spinous process. Good. Now go to
right? You're on the
10 or
right
11
side?
o'clock of
No, I
that.
was on the left side.
Oh, okay, sorry.
It's okay.
Like
Sorry.
up above it.
That's correct.
Yep, but right
Wait, I was on
adjacent
this
to
one,
it,
yeah.
so you're right
No,
next to
I
it.
think you're on the.
It was really good. You could be a little bit more into it for both the depth and for during the treatment. So you were just sliding a little bit too much in the skin, so do it one more time.
Do you use your thighs before?
Yeah.
Yeah.
Yes. Yeah.
So the thing, I was feeling that more like more tone. This one is more painful, I would say, when you are in the spot.
I felt like you.
Left side was more tone.
You're almost wanting to start a little bit more lateral.
Oh, right there.
You just want to be directly adjacent.
Feel this.
You're gonna go in. Now you're gonna pull towards you. Yeah. And now you're gonna keep it there. Tuck my chin.
Yeah, pull.
Oh yeah.
Yeah, try and walk out that
I don't like
shoulder
that.
so
Oh.
you increase the leverage.
Good. Do you feel it differently? Can you feel it? Okay.
Yes.
So it's just staying in that depth.
Okay. One more.
It's not easy. It's not easy. It's not easy.
For me, this has
Did you go yet?
I'm a lot closer than I thought, anyways.
You
I was a little bit lateral, though.
You are close.
Okay, so get that. Help them get that depth, Chris.
I'm not getting enough depth.
You're doing this?
Mm-hmm.
Okay.
Feels like no tension. Like it just loses the depth.
Yes.
Does that see too, Jim?
Mm-hmm.
Tension 1.
Yeah.
Move your body here. Good. Isometrically. Now drop.
Mm-hmm.
Good.
Way better.
Good. Stop there. Good. Tension 1 is a finger a little bit. Tension 2 is pull your elbow back with your bicep. Good. And now keep pulling with your tricep and tuck that in. Don't lift the head. What do you feel, John?
He's like stripping a little bit, like he's moving.
Sliding too much.
Yeah.
Okay. You do want to externally slide a little bit.
Yeah, but he's coming, like he wants to get more.
He's coming out
Yeah.
of it. Yeah, so you don't want to lift the leg.
Okay.
It's this and this.
Let's switch.
Yeah. The EOP.
Okay.
Come forward a little bit, I'm sorry. And then as you're lifting,
Yeah.
you should, this
Press
gentle pressure down, because that's the cervical flexion that you want to create, right?
Yep. Thanks.
Or the upper cervical flexion.
Keep driving upper cervical flexion with that left hand. How'd that feel?
That feels better.
I also feel like I might be just up a little bit. Can you, does that make sense? Am I like
Too far
yeah, am I parallel with like, try to drop your knee down just a little bit?
Okay.
Yeah, right there.
Okay.
Yeah.
Thank you.
You can a little bit.
I think that'll probably be a lot easier, yeah.
They will overdo it. So you can a little bit.
Should I kind of like have this as anchored like more higher up? So that I can kind of,
If it gives you more space, sure.
because my hardest thing was like I felt like I wasn't really giving.
So yes, then this needs to be back down that way.
Like that. So then
Okay, now that you mention it, I see myself.
Good, and I think, make sure you're using the leverage here
Okay.
on your arm. So when you drop in, right, like when that body drops, that pressure should go up. And don't be afraid to put a little bit more down on here, because you don't want it to come up so much as you want it to just do that.
Okay.
C2 spinous process. 1 or 2 o'clock here.
Alright.
Fulcrum.
ELP2. Major.
Sinking in. Subspinalis. Major's right there. Finger 1.
Lift the knee. There you go.
2. You need this.
Drop this has to come up.
Which hand are you using?
This one?
You're on more of the right side of the midline.
See, you're doing that too.
Yeah,
See?
start with the C2.
Find the C2 spinous process. Talk out the steps.
Okay, EOP.
C2, and then you really just like right off
C2.
the edge of the C2, like superior lateral edge of the C2.
And a little superior too.
Right there.
Good.
Oh, okay.
But pick up your finger entirely and then place it back down so you don't pull skin.
Reinforce the finger with the middle finger. Slowly just take that.
Yes.
It's nice and slow. Take the depth in. And use their leverage. Use that leverage. Let me feel the finger. Don't move the top yet. Don't move this yet. Just get your depth
Tell
first.
me.
Go back.
Just keep going in and
Slow down.
Okay.
Your tension 1 mixed into tension 2 mixed into your treatment pass. So I want to feel more deliberate tension 1 with your fingers. Then stop.
Okay, I'm gonna start over. Is that okay?
Mm-hmm.
Yeah. I'm gonna sink in.
I still feel like you're
Pull a little skin.
fingery
I'm pulling skin.
versus
Little bit.
leverage.
Okay.
Does that make
How
sense?
about that?
Yes.
Better.
Okay. Tension 1. Tension 2.
Yeah, that feels better. Just like,
Wow. Yeah, that was significantly different too.
use the leverage good. And now the first one is going to be
You mix tension 2 with your treatment pass.
Like
And I think that caused you to just not feel if you were directly into the tissue or not.
Okay.
Let's do it one more time. I'm going to help you.
Okay.
For me, it's fine. I was like,
And I know this one's hard. This is one where you can, in theory, will use your assistant.
push down.
You could use them?
Yeah,
Okay.
I'll show you.
I guess. So it's think of like the pivot on the C-spine. Like that's what you want.
So he was saying that mainly pushing here.
You're good. So right here.
okay.
So I think your hands were
Go back.
too high on me.
Okay.
So that's why it's founding the physical
Take
and
your
also
finger
because
off so you don't get into this.
Mm.
And then reset.
Stop.
down.
So find the C2, and then you just come off it a little bit.
so I can't hold
And
it
that's
with my
fine. I
fingers.
remember feeling last
I know, but one of the
But I
keys
got
is
it.
though when your tension 2 is, you're coming out a little bit and then you just keep sliding. So you
Okay.
can
I see what you're saying. I
Come on,
I
your
can't
back.
figure out how to. Please switch hands.
That's better.
So that's why when you do this side, you go
which
I'm gonna do this
Keep
side.
the
Is that
tension
okay?
up and in. Just keep that pressure down with your body. Good.
your force is
Tricep
Uh-huh,
pull,
okay.
reverse
Where are you?
reverse pull.
I'm on it.
Yeah.
you're on it, you take depth.
I'm gonna take that now.
Pulling down. Keep that.
More off the
that
side.
head down. Yeah, you let go of it. You got it back. Cool.
Yeah, I understand that.
Tension 1.
People does it too much.
Yeah, I get it.
It's gonna start doing that too much.
You got it?
Mm-hmm.
Good. Go.
Here. You can start here.
Do you feel deep slide?
Just a little bit.
You don't.
No, it's my hand. Look at my hand. Curled up.
Not gonna do that.
Yeah.
This hand's over
Straight
here.
in. Okay.
Okay,
Then
gotcha.
pull out, bow out the
What are you doing with the left hand?
spinalis capitis.
Am I supposed to be right-handed for this? On this
Oh,
treatment side?
okay.
Or should I be other
And
thigh?
then tension.
Yeah, you're just all mixed up.
Okay.
Second tension.
If that thigh is going over here, then this forearm's going to be on this leg.
Gotcha.
Use your body. Yeah.
And then this hand is on top,
Lock your shoulders
Yep.
and
Okay.
everything.
like this. Good. And you just need a little more space for that elbow to drop.
Okay.
Still, keep your finger there. Okay.
I want to see that at like a 45-degree angle, because this is just a lot. So you want to be here.
Tension 1 is going up,
Depth 1 is going up,
and then out.
out, straight lateral.
Yeah.
Depth 2, then tension 1 is straight towards you, and tension 2 is straight towards you.
I see. Okay.
Depth is in, tension is parallel to the tissue.
And then you're gonna move to the side.
So cervical flexions, just like this. Does that feel alright? I want to push your head.
Yeah, just raise your knee too.
Raise your knees. Boom. Like that?
Yeah.
Try both hands.
So remember the test
James,
that we were doing?
you're gonna come move me into upper cervical flexion. So don't do anything yet. Push my forehead down.
Is a tender touch.
Like that?
Oh, okay, like that.
So you want your elbow in
Oh.
a straight line with my
Use both hands.
C2 right here.
push.
Slow down.
I was always focused on being the best I could be and knowing that, the money would come. People are a little uncomfortable talking about money. The money would come if I was doing a good job. That is true. But if you're not valuing yourself for the job that you're doing, you may not be charging appropriately. And I think because of the results, because of all the time and practice put into it, this increase of income has changed everything. I mean, the practice is giving us a better life. Like you think, oh, I went to chiropractic school, so now this is just what chiropractors make. This is just where we're settled to do. And it's not. And you can actually really be paid what it's worth with all the work that you've put in, and not just settle for being like, oh, like I'm coming out of school. They'll be like, oh, you're not a real doctor. You're not doing this, or you're not doing that, or you're not paid effectively. And it's like, I think one of the best things, and it really resonated with me since doing this work, is I have a friend who's a surgeon, and she says, well, other people don't understand because we heal people with our hands. And they feel like we should be valued in that way. So I think we just have to value ourselves in that way, right? So it's changed, our whole life, my family, now it's just like, okay, I can see where this is going, and it's not just gonna be a to get by kind of thing.
You're not working so hard.
Which side are you cheating?
I'm gonna just do the right side.
Okay. Right now you're.
So, am I on the left?
Tell me what step you're on.
I am on finding C1.
Okay. So first, lateral flex me to the right a little bit.
Yeah.
Find the C2 spinous process first. It's a bony knob. This guy.
That's C2?
Yes.
Okay.
That. Now just come up a little bit. Being mindful that my body's tilted a little bit to the side. That's where you want to be.
Right in this.
Yes. So
Okay.
depth 1 is straight in a little bit. Good. Depth 2 is off to the side. Good. Depth 2 is straight in. Sink in more, drop your sternum. Good. Tension 1 is a little bit up. Tension 2, now you pull with your lat. Good, that's it. That's good.
Really?
Good.
Tension 1. 2.
Yeah.
Feeling shaky.
Not shaking. Use this.
Yeah.
This. So your lat. If you need to flex your hand and forearm, it's going to be way more load. So this is just staying isometric. The rest is doing the work.
There.
Okay. Keep pulling this back. Did you feel it?
Yeah, I felt better on this side, but still I feel this shaking. Yeah.
Well, you are having some
Are you
force
in
there,
line?
but this needs to.
Yeah.
This is doing more of it. This
Yeah.
is. If you're having to really push this down, then.
Okay, no, but I felt better on this side.
Mhm.
Okay, feels more steady.
Okay, good.
Yeah.
Good job.
Yeah.
Awesome, guys. We'll do a little bit more before lunch. Okay. So this is super important and valuable. The nerve roots at the scalenes. This is arguably the most important thing we will treat in the neck. This is the side of the neck. This is SEM right here. If I take away the SEM, here we go. This is anterior scalene. The nerve roots come out between anterior scalene and middle scalene. That's where they come out here. Generally speaking, anterior scalene, middle scalene. What we're going to be feeling for is just nerves going down like this, the side of the neck. It'll be easier if I show it to you. Someone come lie on your back, please. We're going to spend a lot of time palpating because this is the whole key for this area.
Bless
Come
you.
lie, come
Which side are you doing,
Thank
Chris?
you.
I can do the right side.
Okay.
Can I have a body marker over there? Have a little bit of lotion, please.
You have someone on there.
It's a, oh, thank you.
Oh, right.
Thank you. I'm gonna draw on you, okay?
Mm-hmm.
Okay. What's our territory? Here's SEM. This is all SEM. If I bow this out of the way, anterior scalene is right where my thumb is. So I'll draw oh boy, way too much. Oh boy. You're too greasy, James.
Sorry. I eat so much bacon. I think it just reeks out of me.
Delicious. No, I'm just kidding. It was me. I put too much lotion. Yep. That's anterior scalene. The middle scalene essentially covers the TPs on the side.
What's TPs?
It's right straight up lateral on the spine. That's middle scalene. There's a lot of stuff going on here. So this is where palpation and understanding the principles really matters. Generally speaking, this is my territory. So there is stuff in the front of the neck, which we'll ignore for this moment, although he might have some fun stuff to treat over here. SCM, anterior scalene. Usually we're looking in this territory from under SCM, lateral, to middle scalene, and then posterior scalene to levator scap, which is right there. So all of this between my fingers is where we're checking. I usually start down here, and I'm looking for supraclavicular nerves, which you might feel something swollen on somebody or stuck. And that will be something that will be important to treat. But usually we're going to be feeling for nerves just going down this way underneath the clavicle. And this stuff is subtle. So here's a nerve going down that way. I'm going to have you work on being very soft and feeling for little noodles. All going down that way underneath the clavicle. That's posterior scalene. Levator scap is right behind it. For now, what I want you to do is we're just going to isolate tissues. So you're going to roll over SCM. I'm on the medial side, I'm on the lateral side. You're going to use your finger to get on the lateral portion of the anterior scalene, under SCM, on to the medial portion, bless you, of anterior scalene. Then I want you to find the middle scalene over the TPs. Roll over that tissue. Lateral portion of middle scalene, anterior portion of it. That one goes all the way up to C2. Then you're going to find the posterior scalene. This one might be awkward to do it like this. Right now my index finger is on anterior portion of the posterior scalene, posterior portion of it. And then I'm going to follow it up towards the mastoid. So SCM, anterior, middle, posterior. Then I want you to go fishing for nerves. And you're just going to be super soft, sink in, and you're going to wiggle. You're going to be able to find stuff, especially if stuff is swollen, because it gets way thicker. He's got a swollen nerve right here. I'm going back, and you could almost see me clicking over it. And you're just going to practice feeling nerves up and down. So challenge, can you feel 3 different nerves? Or can you trace one nerve up and see how far up you can trace it? And seeing if you're owning it. Then after lunch, we will practice bowing it and then treating it. The junction.
Middle.
Middle and posterior.
Or levator scap and posterior. Posterior scaling ends at C4, I believe, though. It doesn't go all the way up to C2, like middle.
Middle goes up the highest.
Middle goes up the highest.
I think so. That's middle, right?
You're good.
I mean, it's awkward because it's back here, but
The anterior portion's back there or the posterior portion? I mean both, but like you're posterior scaling, but you're on the front of the posterior scaling.
right now I'm on the front of the posterior scaling.
Okay, yeah,
so
yeah,
here's
that's
middle
right.
scaling and
Okay.
here's posterior scaling, and I'm in this space right now.
Yeah.
And I can feel I'm knocking the middle, and then right now I'm knocking into posterior on the anterior side. And then if I go backwards over here, now I'm between
Between levator.
posterior and levator. I was having to use my other hand to do this. So
Like in here.
over the top.
Over the top?
Yeah.
Oh.
To really appreciate the borders. Posterior scaling, levator scat.
Yeah.
That's the space.
Okay.
That's the junction. That's on top of posterior scaling. Now I'm in between middle and posterior.
Oh yeah, okay. I could do that one this way though, right? Middle and posterior.
If you can, you can.
But I see what you're saying.
I find it helpful to try to use, like even for when I do the belly, then I'll try the other hand. I notice sometimes just the way that fingers grab things, it just rolls on them.
This is middle scaling.
Yes, I think that's the posterior part of middle scaling.
Just the back end
I
part.
think so.
The junction.
Middle and posterior.
Or levator scap and posterior. Posterior scaling ends at C4, I believe, though. It doesn't go all the way up to C2, like middle.
Middle goes up the highest.
Middle goes up the highest.
I think so. That's middle, right?
You're good.
I mean, it's awkward because it's back here, but
The anterior portion's back there or the posterior portion? I mean both, but like you're posterior scaling, but you're on the front of the posterior scaling.
right now I'm on the front of the posterior scaling.
Okay. Yeah,
so
yeah,
here's
that's
middle
right.
scaling and
Okay.
here's posterior scaling, and I'm in this space right now.
Yeah.
And I can feel I'm knocking the middle, and then right now I'm knocking into posterior on the anterior side. And then if I go backwards over here, now I'm between
Between levator.
posterior and levator. I was having to use my other hand to do this. So
In here.
over the top.
Over the top?
Yeah.
Oh.
To really appreciate the borders. Posterior scaling, levator scat.
Yeah.
That's the space.
Okay.
That's the junction. That's on top of posterior scaling. Now I'm in between middle and posterior.
Oh yeah, okay. I could do that one this way though, right? Middle and posterior.
If you can, you can.
But I see what you're saying.
I find it helpful to try to use, like even for when I do the belly, then I'll try the other hand. I notice sometimes just the way that fingers grab things, it just rolls on them.
This is middle scaling.
Yes, I think that's the posterior part of middle scaling.
Just the back end
I
part.
think so.
It's all gonna be crappy, so if it's not crappy, then it'll
I
be.
think this is the anterior scaling.
Talk it out. He can help you, James.
Feeling the anterior scaling,
Are you feeling the borders?
The border.
the border.
You should be feeling clean pieces of meat.
Got it. So this is the
Medial side, medial border.
yeah, and then right here's the posterior side. Would you say?
Yes. Yes.
Okay.
Yes.
Yeah.
All of that. So you can slip over the side of it,
Mm-hmm.
and then you're on top of it, anterior.
Got
Be
it.
careful though.
Yeah. Don't want to kill him. I'm sorry. I'm like,
It feels good. Actually, it feels good, but it's painful too. Yeah.
I'm gonna try feeling on the left side. SCM.
Is my head resting on that? So if you take this out and you hold my head, you're gonna have more control.
Okay,
of my
slide
entire
out.
head.
I'd rather he didn't,
Oh, okay.
because I don't want him to work so hard.
Okay.
Unless you like to do
I like
extra work.
having the-
You like to do extra work.
Okay. I like to do extra work.
No, you can do it that way, but
Okay,
Yeah.
no, I get what you're saying.
it might be a little harder this way. But it's start off practicing hard.
Okay.
Okay.
That's it right there. That's me on top of it.
And then we're gonna come through. There's the anterior part of your, the front of your anterior scalene.
That's it.
Right here's the
lateral.
the posterior part of the scalene, the lateral side. Okay. I'm gonna try to find middle scalene. So first I need to find SCM. Lateral side of the anterior scalene. Ooh. Would you say this is the anterior, the middle scalene?
The anterior, the medial border.
The medial
Yeah.
border.
Yeah. And just trace. Let's see if you can trace it down. Yeah, it feels.
So what I'm doing is I'm making all the superficial nerves pop out, supraclavicular nerves, the supraclavicular devices. And then, in fact, this is how we would probably treat those nerves if we were feeling them pull tight.
Okay, so would you be having like a CA do this
Yep.
part while you're treating?
So I'll either have her pull this for the superficial cervical nerves, or sometimes pushing down gives greater access to the nerve roots.
Sure, okay. 'Cause it just kind of opens up that whole compartment.
It opens it up. It can create space so you can get your fingers in there easier.
That makes sense. Okay.
But this is the one that the superficial nerves will pop out.
Okay. Yeah, I was gonna say, it's gotten a lot easier to feel on since you started doing that.
I feel something like this, and I'm like, okay, well, that's not moving anymore.
But is it swollen or is it?
If a nerve is very obviously able to feel, then it's likely swollen.
Yeah.
Because
Okay.
nerves aren't supposed to be obviously, yeah.
I'd say there were
they're usually
only a couple
swollen
of them that were really quite noticeable to me, but other than that, it was just,
No, that's
just
a nerve.
yeah, just kind of running it over
Because
slightly.
you get all sorts of referrals.
So are all of them like, so if you're feeling the nerve pretty easily, that's much more like speed bumpy, that's probably an inflamed nerve. Or is that
Well,
just
speed
not-
bumpy will be hypertonicity, I would think more. Swollen nerve, if you're really, this is still a challenge for me over the past year, but if you really slowly compress into it, it'll feel squishy, like there's inflammation inside of it.
Okay.
Yeah, that feels rigid more compared to the other one.
But if you feel a swollen nerve, then you typically want to follow it proximal to see where it's entrapped and stuck. And then if you free that up, then the swelling should immediately go away.
Okay, then I don't know that necessarily any of them might have been swollen, and I wasn't, compressing into them to really see what was going on with them.
Okay,
I think I was just palpating them.
got it.
Yeah.
Did you guys switch yet?
Yeah, we switched up.
Nice. If you want to keep going, we're not going to do anything else till lunch.
What's hypertonicity?
Put this way.
A normal muscle is like a piece of steak and it's supposed to be soft. Hypertonicity is like the steak it's contracted. It feels like somebody's making a bicep, but in just a smaller bundle of the muscle fibers. It's like a knot is another way, or trigger point is another way to think of it. It's a good question.
I just felt like a spot
Right?
that
Yeah.
felt a lot more diverse.
Yeah.
But there it's not, right?
That whole thing is not super loose.
Yeah.
That was all tight.
Yeah, that's way better.
It's a good start. You want to get this done next though.
This, okay.
So people make it harder.
Yeah.
Feel it
You're
again.
also taking this.
Yeah,
whole
this
hand.
hand, you said something about this. Okay, here. Okay. And then her head kind of feels like it's falling, like it's kind of,
I
that's
usually
okay.
start, I don't
Or-
bring this up so that your hand is resting on the headpiece.
Oh, okay.
Ooh, I'm gonna shit myself.
That'll make the YouTube cut.
Not ready for that at all.
Oh boy. So when you need more isolated lateral flexion, more segmental, you're like pulling the whole thing over. You need to push
Okay.
that hand in more specifically right at the spot where your other hand is. Yeah, that might be
That's
it.
the spot where
Yeah.
That go up to
Yeah.
you know
So
that
then,
spot I was talking about earlier.
like
it's
that?
That's
Yeah.
it. Yep. No
It's not
rotate.
as tight anymore. It gets definitely less
Okay.
sensitive.
Okay.
I just felt like a ball.
So, like,
That's pretty cool.
Yeah, that's way more specific. You know what I mean?
Yeah.
Now, once you find the spot, you want to have your depth. Like, if that's the nerve, you want to go deep in here.
Mm-hmm. And then bow against it.
No, because you already know there's not bowing down.
Mm-hmm.
So now you take your depth,
Skip between it.
and then once you have your depth, which you can go deeper,
Right there.
there you go. What I love of that technique is that you see results immediately, especially if you follow the steps and you follow the protocols. Testing, treating, and then retesting. You can see immediately on their faces that or the pain is less or the range of motion is much bigger, even if the pain is still there at the same number that they had it before, but they can see how much their range of motion changed. So for me, it's mostly that, seeing immediate results. For someone who's been suffering pain for years sometimes, changes on just one treatment, 2 treatments, that's amazing, yeah.
Yeah, I feel like I'm going upwards. How does that feel?
Now I feel like you got this one. Let's just get them
Does that feel nervy, James?
Mhm.
It feels tiny.
Mm-hmm.
Right here.
That's much better.
How's that, James?
I felt, yeah, I was able to feel the nerve because it's like it's going like
This
across
is the
fiber
nerve right
feeling
here.
to all the musculature.
And then my
I knew
finger.
that was nerve. I was like, okay, this is what we're gonna work with.
Yes.
I always remember when
My nerve's a little swollen here.
you're like,
It might be. It felt pretty thick. So if it's swollen, then you want to trace it more proximal.
Yes.
it's going here, but it's not.
You want to trace it like that way.
So the first thing that you want to do is like.
And you want to find a spot that
digging
doesn't
into
mow
the
more
board.
and it's
Yeah,
stuck.
so you found the nerve, right?
Yes.
And you notice that it's not going that way. So the first thing that you want to go is deep,
Uh-huh.
like perpendicular to the structure, the same way that you were doing on the thigh.
Oh yeah.
Go-
Hey,
And
do my
then
left
once, and
Here?
you're working with this part of your thumb, so it would be,
Oh, this part?
yeah.
Oh, I thought we were working on this.
I know,
No, it's this
like
part.
trying to dig
Okay, so
away
here.
at it.
Yeah, so you go deep,
Deep there.
and then you do your tension clock. Usually it's in the same line as your.
So
His artery is very
Yeah,
pronounced.
so now you're holding here, and by bending the neck, you're feeling the nerve.
Mm-hmm. I see. So I have to hold that
Yeah.
whole thing and then.
And your hands usually go.
So then you want to go in.
Slide out a little bit.
Something like that.
Right next to the artery.
Well, the nerve is right here, I believe. Is it not?
Yes, but the artery's right immediate to
Well,
it.
just pay attention to where the artery is and then don't go next to it.
Okay.
But drive the elbow so that it creates tension, going like
So if
this.
you work with this part, your thumb is in line with your.
Try to get this portion of your thumb, not your pad.
See, that's a straight line here. And then you go deep, and then do the tension clock there.
Okay.
And then you're going to drive that as you push the left thumb web into his whole side of his neck.
Oh yeah.
So I couldn't find anything deeper.
So now that you have this spot, I like to.
I don't feel
I
pulling.
know that here.
Okay, so then your setup wasn't
Forward.
on
Yeah,
top.
just to-
But practice first driving that and moving his head. The big wide hand. Yep.
But he's gonna get.
No, I know. But into the web, and this part is also moving the skull. And this is driving to create tension as well.
But actually,
I feel that a lot.
okay.
So if you pick a spot and you're driving in, it's going to be like this.
So now that you know here, I'm just going deep.
That's what it's going to be like. You happy? Why are you smiling?
We're learning good stuff, and I'm around people that I like.
That's the end of this brief 80 to 90 minute video on our accelerator trainings. I hope you saw how technical some of our treatment procedures are, our diagnostic principles are, how we palpate, and got a behind the scenes look as if you were actually in that training, what we're actually doing. A lot of doctors and therapists will see our stuff on Instagram or YouTube, and then they'll try stuff on their patients, and they'll comment back and say, oh, that worked on this patient, the patient was so happy, so on and so forth. I'm very happy with all of that. I'm very happy with you inside of our online sciatica specialist, non-surgical chronic pain specialist curriculum. But I also want to make sure that we are continuing to up-level our skill sets, because the amount of people in chronic pain in the United States and across the world isn't getting smaller, and it's only going to get larger as all the baby boomers get older. So I hope that this inspires you to put in the work, to put in the focus, to put in the reps, to do what you can to get better. And if you're open to coming out here to train with us in New Jersey or with my mentors, Precision Health Group in St. Louis, we'd love to have you, because we need to up-level, rise all ships in our boats, tides. Yeah. Rising tide raises all boats. Go get them. If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe. Stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.